Stop. Before you swallow that blood pressure pill this morning, your Amlodipine or Lisinopril, I want you to answer one honest question. Do you actually know what that little tablet is doing to your heart, your kidneys, and your blood vessels right now at this very moment while it sits in your stomach? Not the folded paper insert you threw away, not the one line your pharmacist mumbled while ringing you up. I mean, truly understand it, because if your answer is no, you are not alone, and you are about to become one of the most informed patients your doctor has ever met. I am Dr. Rachael Augustine, and for the next few minutes, I am going to walk you through exactly what happens inside your body when you take Amlodipine, Lisinopril, or Losartan. These three medications sit in nearly every senior's pill box in America, and yet most people taking them have no idea that each one behaves completely differently once it enters the bloodstream. That gap in understanding is the reason otherwise careful, intelligent people end up frightened, misdiagnosed, or worse, in the emergency room for something that could have been caught weeks earlier. So here is my promise to you. By the end of this video, you will know precisely which warning sign belongs to which medication, what is simply an annoying but harmless side effect, and what is a genuine medical emergency that requires you to act immediately, not tomorrow, not after breakfast, immediately. Stay with me because the story I am about to share with you is one that plays out quietly in millions of homes, and it very well might be playing out in yours right now. Let me introduce you to a woman I will call Margaret. Margaret was 76 years old, a retired school teacher, the kind of patient who never missed an appointment and read every pamphlet handed to her twice. When her cardiologist added amlodipine to her existing regimen, she assumed it was simply another blood pressure tablet, interchangeable with the ones she already took. Same goal, same category, nothing to think twice about. That single assumption nearly cost her months of comfort and mobility. Within 8 weeks, Margaret noticed her ankles had started spilling over the top of her shoes by early evening. Her favorite loafers no longer fit, and her legs felt swollen and tight, almost as if they had been filled with water. She began cutting back on her afternoon walks because standing for long periods made the heaviness unbearable, and convinced something was seriously wrong with her heart, she spent several sleepless nights researching congestive heart failure, growing more anxious with every article she read. The truth was far less frightening, but nobody had ever explained the mechanics to her. Amlodipine, Lisinopril, and Losartan all lower blood pressure, yes, but they are not variations of the same drug. They belong to entirely different families, and each family interacts with your body through a completely different pathway. Amlodipine is what is known as a calcium channel blocker. It works by relaxing the smooth muscle lining your arteries, allowing blood to travel with far less resistance. Lisinopril belongs to a different class entirely, called an ACE inhibitor, which interrupts a chemical process responsible for tightening your blood vessels. Losartan works one step further down that same chemical chain, blocking the receptor that responds to that tightening signal, which sounds similar to Lisinopril on paper, but produces an entirely different set of risks in practice. 3 different mechanisms, 3 different sets of warning signs. Once Margaret understood that amlodipine specifically was known for causing exactly the kind of ankle and leg swelling she was experiencing, her fear evaporated. This was not her heart failing. It was a well-documented, predictable response to how the drug relaxes small arteries faster than it relaxes the veins carrying blood back upward. Blood pools in the lower legs, pressure builds near the ankles, and fluid gets pushed into the surrounding tissue. It is uncomfortable and visible, but in most cases not dangerous on its own. What is dangerous is how people respond to it. Some quietly stop the medication without telling their doctor, and their blood pressure creeps right back up while they congratulate themselves for solving the problem. Others start restricting water, mistakenly believing they are retaining fluid, which only sets them up for dehydration. And some, like Margaret, simply endure it silently for months, shrinking their world one missed walk at a time. Here is what I want you to remember. If you notice that heavy, swollen feeling creeping into your calves and ankles by late afternoon, that is a conversation to have with your prescriber, not a secret to carry alone. There are options. Adjusting the timing of your dose, elevating your legs in the evening, or in some cases switching to a different medication altogether. None of those solutions can help you if you never say a word. Now, tell me something in the comments below. Have your ankles ever swollen after starting a new blood pressure medication, and did anyone ever explain why? I read every single comment, and I promise you, you are far from the only person dealing with this. Let's move to Lisinopril and the side effect this drug is famous for among physicians: a dry, scratchy, absolutely relentless cough that seems to come from nowhere. This is not a cough with mucus. It does not respond to lozenges, cough syrup, or antihistamines, and it tends to worsen the moment your head hits the pillow at night. What makes this particular side effect so easy to miss is its timing. Some people develop it within the first 2 weeks of starting the medication. Others do not notice it until 4 or 5 months later, long after they have mentally filed the new prescription away as something that agreed with them just fine. By the time the cough begins, most people never connect it back to a pill they started nearly half a year earlier. I think of a gentleman I will call Harold, 79 years old, a devoted birdwatcher who spent hours outdoors every week. When his cough began in early autumn, he blamed dry air, seasonal dust, even a lingering cold. He tried a humidifier, honey and warm tea before bed, and imaging his physician ordered came back completely normal. 7 months passed, his sleep grew worse, and he began to worry something serious was being overlooked. When I asked him a simple question, when exactly did he start Lisinopril compared to when the cough began, he pulled out his phone to check his pharmacy records. The math was undeniable. Roughly 3 months separated the two. Once we worked with his physician to transition him to Losartan, a medication on a similar pathway that is far less likely to trigger this particular cough, the irritation in his throat disappeared within 10 days. 7 months of disrupted sleep resolved almost immediately once someone finally connected the dots. But now I need you to listen closely, because there is a symptom in this same category of medication that is not an inconvenience. It is a true emergency. If you are taking Lisinopril and you notice swelling of your lips, your tongue, your face, or the back of your throat, especially if breathing or swallowing starts to feel difficult, you do not wait to see if it passes. You do not schedule an appointment for next week. You call for emergency help immediately. This condition is called angioedema. It is uncommon, but it is real, and it can restrict your airway far faster than most people would ever expect. A dry cough is simply a nuisance. Facial or throat swelling is a medical emergency. Please hold on to the difference between those two, because it genuinely could save a life. And if nobody has ever laid out these 3 medications this clearly for you before, this is exactly the moment to hit that subscribe button, because what comes next may matter just as much for your safety or for someone you love. Now let's talk about Losartan and a danger that catches people off guard precisely because they believe they are doing something healthy. Losartan works on the same internal chemical pathway as Lisinopril, and one known effect of that pathway is a gradual rise in blood potassium levels. For most people, this stays perfectly manageable when a physician is monitoring it regularly, but layer certain everyday habits on top of it, and the picture can shift quickly. Here is the part that surprises almost everyone. Potassium is not only found in bananas or vitamin bottles, it is hiding inside products marketed directly to seniors as the heart-healthy choice, salt substitutes. Many of the low-sodium seasoning blends sitting right next to regular table salt on grocery shelves replace sodium chloride with potassium chloride instead. So a senior who has been told to cut back on salt reaches for one of these substitutes, uses it generously at every meal, and unknowingly begins stacking potassium onto a medication that already nudges potassium levels upward. That combination can push potassium high enough to interfere with the electrical rhythm of the heart itself. And the unsettling part is that elevated potassium rarely announces itself loudly. Instead, it whispers through unusual muscle weakness, persistent fatigue, cramping in the legs, tingling in the fingers, or an irregular fluttering heartbeat. If you or someone you love switched to a salt substitute in the past year or two, while also taking Losartan or Lisinopril, this deserves a real conversation with a doctor, not because either one is inherently dangerous, but because the combination, left unmonitored, can quietly build into a problem nobody saw coming. Electrolyte powders, protein shakes, and sports recovery drinks carry meaningful potassium too, and since none of them require a prescription, almost nobody thinks to mention them at a medical visit. There is one scenario I rarely hear discussed, and it affects seniors more than any other group. What happens to these medications when your body gets sick? Not seriously ill, just an ordinary stomach bug, a few days of vomiting or diarrhea, or a stretch of summer heat with heavy sweating and not enough fluids. When your body becomes even mildly dehydrated, the exact same dose of Lisinopril or Losartan that was perfectly calibrated for a well-hydrated body can behave in an entirely different way. Blood pressure can fall lower than expected, and kidneys, already under stress from fluid loss, become more vulnerable to injury. The medication has not changed, your internal environment has changed, and the drug is now operating in conditions it was never designed for. Illness rewrites the rules. If you do not already have a plan from your doctor for what to do with your blood pressure medication when you are sick, whether to pause a dose, when to call the office, which symptoms should send you in immediately, you are carrying an unnecessary gap in your safety net. Ask for that plan before you ever need it. Here's a quick question for you. Has your doctor ever given you specific instructions for your blood pressure medication if you come down with a stomach virus? Drop a yes or a no in the comments, because I suspect most of you are about to give me the same answer. Now picture this. Your knees have been aching all week, and you reach for the same bottle of ibuprofen you have trusted for years, sitting right there on the shelf next to the aspirin and vitamins. But if you are also taking Lisinopril or Losartan, especially alongside a water pill for fluid management, this combination can meaningfully reduce blood flow to your kidneys. Add even mild dehydration into the mix, and the risk of kidney injury climbs substantially. This is one of the most common and most preventable situations I encounter, because over-the-counter pain relievers do not feel like real medication the way a prescription bottle does. But your kidneys do not care whether something required a prescription, they respond purely to chemistry. If you regularly reach for anti-inflammatory pain relievers for joint or back pain while taking any of these 3 blood pressure medications, bring it up with your doctor. There are often gentler paths available, whether that means acetaminophen, topical treatments, or physical therapy approaches that spare your kidneys entirely. Let's talk about something that sounds minor and absolutely is not, that brief wobbly sensation when you rise from a chair or climb out of bed in the morning. The room tilts for a second, you steady yourself against the nearest piece of furniture, and then it fades and you carry on with your day, assuming you simply stood up too quickly. For many seniors taking blood pressure medication, this happens regularly, and it is almost always dismissed as too small to mention. Here is what I need you to truly absorb. In older adults, a few seconds of dizziness is all it takes to cause a fall. A fall is all it takes to cause a fracture. And a fracture, particularly one involving the hip, can alter the entire trajectory of a person's health for years, sometimes permanently. This is simple biology, not exaggeration. Your medication is lowering your blood pressure exactly as intended, and when you rise too quickly, your circulatory system has not had a moment to adjust, so blood flow to the brain briefly decreases and you feel that unmistakable tilting sensation. The fix is often refreshingly simple. Rise slowly. Sit at the edge of the bed for a few seconds before standing fully. Hold onto something steady while your body catches up. But if that dizziness continues week after week, or if you ever experience a near fainting spell, that deserves a real conversation with your doctor, not silence. Let me clear up something that creates a tremendous amount of unnecessary anxiety. Your blood pressure is not a fixed number. It shifts constantly based on sleep quality, caffeine, stress, pain, and even how recently you walked into the room. A single elevated reading on a rough morning does not mean your medication has stopped working, and a single low reading on a hot, dehydrated afternoon does not mean your dose is too strong. What actually matters is the pattern over time, measured consistently, same arm, same time of day, after a few quiet minutes of rest. When people react emotionally to a single number, the decisions that follow are rarely good ones. An extra dose taken out of fear, a skipped dose because yesterday's reading looked fine. Track your numbers over time. Bring that log to your appointment and let the overall pattern guide the conversation, not a single frightening screenshot. And if you have made it this far and you are finding real value in this video, type the word READY in the comments below. It tells me you are here, you are paying attention, and it helps this video reach more seniors who need exactly this kind of clarity. These 3 medications are designed to create a steady, stable presence in your bloodstream, not to be taken reactively. When that consistency is disrupted by missed doses, doubled doses, or erratic timing, your blood pressure can behave unpredictably, and it is easy to mistake that instability for the medication failing you. If you miss a dose, the general rule of thumb is to take it as soon as you remember, unless it is nearly time for your next one, in which case you simply skip it and continue as normal, never doubling up. But ask your own prescriber for their specific guidance and write the answer down somewhere you will actually find it, because in the moment you realize you forgot, you do not want to be guessing. I want to close with the single most important idea in this entire video, one that rarely gets said out loud. The best blood pressure medication is not the one that produces the most impressive number on a chart. It is the one you can take safely, consistently, and comfortably within the full reality of your life. A medication that looks perfect on paper but keeps you awake all night, swells your legs until you stop walking, or leaves you afraid to stand up is not truly working for you. Side effects are not a personal failing, and they are not you being overly sensitive. They are information, your body's way of communicating through the only language it has, and that information deserves to be heard, taken seriously, and acted upon. Far too many seniors quietly endure side effects because they assume enduring is simply part of the deal. Adjustments exist, alternatives exist, but none of them can help you if you never speak up. If you take Amlodipine, watch for swelling in your ankles and legs by late afternoon and report it instead of enduring it. If you take Lisinopril, watch for a persistent dry cough and remember that swelling of the face or throat is a true emergency requiring immediate care. If you take Losartan, pay attention to unusual muscle weakness or an irregular heartbeat. Review what is actually in your salt substitute and make sure you have a sick day plan in place before you ever need one. Across all 3, rise slowly to protect yourself from falls. Track your blood pressure with consistency rather than panic. Avoid casually combining these medications with anti-inflammatory pain relievers, and never stop any of them abruptly without speaking to your doctor first. You took the time to watch this all the way through, and that tells me you take your health and the health of people you love seriously. If this gave you even one piece of clarity you did not have 20 minutes ago, subscribe, because there is far more honest health guidance coming on this channel, the kind that too often gets left out of a rushed 10-minute appointment. And if someone in your life takes any of these 3 medications, send this to them today, because a few extra minutes of understanding can quietly prevent a frightening night in the emergency room. I am Dr. Rachael Augustine, and I'll see you in the next one.